Alright, I'm going to be scanning the room to show you that there are no notes. Alright. Before I went to my patient's chart or room, I would check the chart. Hi, my name is Michaela and I'm going to be your nurse today and I'm going to be conducting an assessment on you, okay? Okay. I would then wash my hands, provide privacy for my patient, and then identify her. Can you tell me your name and date of birth?
Carolyn Catalano, 13177.
Good. And what brings you in today?
For a checkup.
Okay. And are you in any pain at the moment?
No.
All right. My patient states that she is not in any pain. If she were, I would assess for her pain using the PQRST method. So to start off, I'm just going to be asking you a bunch of subjective questions, okay?
Okay.
So, do you experience any frequent nausea?
No.
Have you noticed any recent changes in your appetite?
No.
And do you have any digestive system issues at all?
No.
All right. Do you have any troubles urinating?
No.
Have you had any frequent UTIs?
No.
Do you experience any incontinence?
No.
And when was your last menstrual cycle?
I had a hysterectomy in 2007.
Okay. When was your last bowel movement?
Yesterday.
And have you noticed any abnormalities in your stool?
No.
And do you experience any frequent constipation?
No.
Okay. So that is all of my subjective data. So I'm going to start by inspecting the abdomen. So I'm going to go ahead and lift up your shirt here. All right. So just by generally inspecting her abdomen, it appears to be flat and is not distended. There are no masses or bulges that are visible to the eye. Her umbilicus is midline and her abdomen all over is symmetric. Her skin is appropriate for her ethnicity. Her skin is warm and dry. There are also no pulsations or distended veins noted. So next I'm going to auscultate with the diaphragm of my stethoscope in all four quadrants of the abdomen to listen for bowel sounds. I'm going to be starting in the right lower quadrant and moving in a clockwise motion. And by doing this, I'm going to be using the diaphragm of my stethoscope. All right, good. So all of her bowel sounds were present. They were all active. They were not hypoactive or hyperactive. Next, I'm going to move to or auscultate for any vascular sounds by using the bell of my stethoscope. And to do this, I'm going to use an upward V motion to locate both of the renal arteries. All right, and then slightly above the umbilicus, the aorta. And then moving down, using a downward V for the iliac. Good, so there were no bruits noted there. Moving on, I'm going to palpate in all of those, percuss in all of those four quadrants, okay? So there's tympany in all 4 quadrants. Next, I'm going to palpate on all of those same quadrants as well. Do you have any pain or tenderness in your abdomen right now?
No.
Okay. So I'm going to start with light palpation and then move into deep palpation. So you just go ahead and let me know if there is any pain or discomfort while I'm doing so, okay? All right, and then moving to deep palpation. All right, any pain or tenderness?
No.
Okay. So my patient states that there was no pain or tenderness in doing that, and there was also no masses or bulges noted. So that is it for the abdomen. You can go ahead and sit up for me. Do you have any deficits or limitations in your range of motion?
No.
All right. And do you have any problems walking?
No.
All right. So I'm going to go ahead and have you stand up, and I'm going to have you walk just to that wall and back for me, and then you can stand right in place afterwards. Perfect. So she has a steady gait with no wobbling or anything like that. So next I'm going to do the Romberg test. So I'm just going to have you stand in place, close your eyes for just a few moments, okay? Good. So that was the Romberg test. Like I said, her equilibrium was normal. There was no wobbling. So that tells me that cranial nerve 8 is indeed intact. So I'm going to go ahead and have you sit on the edge of the bed for me. All right, and then I'm going to have you put your arms straight out for me, and with each hand, touch your nose. Perfect. Good. Go ahead and put your arms down. I am now going to do the Babinski test, okay? Actually, let me move this so I don't know if you can see the feet or not. Good. Move this back. Next, I am going to test your range of motion. So I'm going to go ahead and have you rotate your head in a circular motion, just like this. Perfect. So rotation is good. I'm going to have you go ahead and extend both of your arms out. Good. So extension's good. Go ahead and flex them back towards you. Good. Flexion is good as well. Go ahead and put your arms, actually you can put your arms in front of you and go ahead and flip your hands back and forth for me. Good, so supination and pronation is good. I'm going to go ahead and have you just sit a little bit farther back on the bed for me. And can you spread your legs just a little bit? And can you point your feet inward toward me? Or for me? Perfect. So inversion is good, and you go ahead and point them outward for me. Good. So eversion is good as well. Also going to have you run your left leg or your left heel on your right shin for me. Good. And vice versa. Good. So all of her range of motion is normal. There doesn't seem to be any limitations. So moving on, I'm going to test your strength in your upper extremities first and then move to your lower extremities, okay? So can you squeeze my fingers? And can you pull my hands towards you? All right, and can you push them away? Perfect. And then can you lift your legs straight up? Perfect. Can you push your feet away from yourself? All right, and then pull them towards you. Good. All right, so her strength is normal and it is equal bilaterally both in her upper extremities and lower extremities as well. So this completes my abdomen and musculoskeletal video. So thank you for participating and thank you for watching.